Do you have an HSA, a health savings account, and you're approaching your Medicare decision? If so, there's some really important things to be aware of when it comes to HSA and Medicare. So in this video, let's talk about how to decide the pros and cons of both, because I do love a good HSA, but we have to be aware how Medicare works. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping individuals easily navigate both the Medicare rules from the government, but also the insurance company options to help you do what's right and best for you, so you have that best health insurance while also protecting your retirement savings. And I'm going to share some extra resources down below to help you get the shortcut to Medicare to get what's right and best for you. So let's hop into this. If you're not familiar, there's plans called HSA, health savings accounts. And the beautiful thing about these HSAs is that number one, they work alongside high deductible plans. And two, they have tax benefits. And so you're able to use your HSA tax money to pay for approved medical costs on a pre-tax basis. And these plans can also roll over from year to year. So they're kind of like a 401k for your health expenses. And a lot of people really like HSA plans for the tax benefits, which I agree. So if you're approaching Medicare and you're saying, okay, I'm going to be 65 or I'm going to retire, whatever it is, and I have an HSA account, how does this impact the whole thing? So number one, I want you to know that you can use your HSA money once you're on Medicare, right? So there are times where people bring a pretty big amount of money to Medicare, and your HSA can be used to pay for certain premiums, certain copays, or any other maybe services not covered by Medicare that you want to have covered, maybe like a dental or a vision, okay? So you can keep your HSA money once you're on Medicare and you can use it. But I want to emphasize there are rules around putting money into your HSA account. So the rules say you can put money into your HSA account up to the ladder of 65 or 6 months before you apply for Medicare. So if you're joining Medicare at 65, your HSA contributions should stop at 65. But if you join Medicare at, say, 70, or you apply for Medicare at, say, 70, your HSA contributions should stop at 69 and a half years old, so 6 months in advance, okay? So that's how the overall Medicare and HSA rules work. So what does this practically mean, okay? So let's say, again, you have an employer plan that meets Medicare rules. You know that your employer plan, I guess the first step is that does your employer plan meet Medicare rules? If so, move to step 2. Is your employer plan cheaper and better coverage? If so, we then have to decide, do we want to keep putting money into our HSA, or do we want to have the free Medicare Part A? In most cases, people would rather have that HSA tax benefits in the Medicare Part A, but it's up to you to choose. But again, your HSA isn't a determining factor as to when you join Medicare. The determining factor is, does your employer plan meet rules and is it cheaper? And once we make that decision on when you join Medicare, we then have to decide, okay, but do we get Part A or do we get the HSA? And again, most of the clients that we work with prefer to put money into their HSA and delay Medicare Part A, but that's up to you what you're going to do. But you are not required to have Medicare A or B if your employer plan meets Medicare rules. Okay, I know I'm covering Medicare in a bit of a unique way. That's what we do at the Medicare Coach, but I think it's important to understand the tax benefits and all the different things at play when we're making your Medicare decision. Medicare is a lot more than just picking out an Advantage plan or a supplement plan. There's a lot more to Medicare around your overall healthcare, your overall money, your overall situation. So do what's right and best for you. Again, Medicare can be great when you're thoughtful, but do it right the first time. All right, here's to helping you easily make your right Medicare decision.